So the governor vetoed two pieces of medical legislation that you guys, healthcare legislation that you all sent pretty, I don't want to say, it wasn't unanimous, but it was pretty darn close. Two pieces of legislation to him, one dealing with pre-authorizations for medical procedures to the general public. If I need a colonoscopy, you want to make sure that it's pre-authorized and fair. And the other piece of legislation was for medical reimbursements from insurance companies to facilities. Is that correct?
That's correct.
And he's vetoed them and sent them back to you all, or just killed them?
He has vetoed those bills. They were both Senate bills. They received unanimous votes in the Senate, I believe, both bills, and in the House it was over 110 votes for one and 105, I think, for the other, maybe 5 or 6 no votes total. And so they passed overwhelmingly, and certainly those votes are more than a 2/3 vote, which would be required to override a veto. The governor had a problem with, he articulated in his veto message what his problems were with each bill. He thought that the insurance bill, looking at reimbursements and giving our commissioner of insurance the ability to look at those and see and compare us to other states, is what that bill was about. He thought that was getting over into the world of private contracts and getting in between folks that are contracting for something, and thought that was an overreach from government. We saw it simply as looking at how our providers are being paid compared to providers in other states. The same insurance companies that operate in Mississippi operate in Tennessee and in Alabama and in Louisiana and Arkansas. And so, there's this prevailing, I start to say theory, but I think there's facts out there that providers in other states are reimbursed more for the exact same procedures than our providers are done in Mississippi. And so we wanted to see how our rates compare with our reimbursements related to our neighbors. Specifically, if a Mississippian has a procedure done out of state, is that provider paid more than if the same procedure was done in Mississippi? And so that bill was simply an attempt to give our commissioner the ability to look inside those contracts and see how other providers are reimbursed in other states and compare them to our states. And that was kind of on the heels of the huge disagreement that you saw kind of play out publicly between Blue Cross Blue Shield and UMMC over the last year.
Now, when you talk about that, is it possible that when we just talked about the crisis before, that hospitals aren't able to, I don't want to say they're not able, but they're not paying doctors, nurses as much as other states? Is that directly tied together, that if we were to fix that you would be able to keep more of your healthcare providers here?
Well, I think it would certainly be a factor, because what we hear from providers, hospitals, as well as specialty clinics, as well as doctors, is that their reimbursements are low compared to our neighbors in other states. And so we just wanted to look at that. It wasn't going to do anything other than give us the ability to look at it and come back to the table, so to speak. And so,
I'm going to add one thing to that. One of the biggest problems that all hospitals have is getting paid. Regardless of what the reimbursement rate is, if you don't pay it, it's not doing any good. And one of their biggest problems is they're not getting paid. They're insurance. It's not just Medicaid or Medicare. It's the insurance companies, and for whatever reason, they delay 6 and 9 months. Well, you take any business out here. You can take a little small mom and pop business out here. If they don't get paid, they can't stay in business, and that's what's killing the hospitals. Is they're not getting paid timely.
No, and you see, I've seen several folks with big hospital bills that they go in for, a burn, and you wind up getting a bill for $500,000, $600,000, right? The insurance company gives them a portion, which is on the statement, and then the hospital says, okay, well, we want X amount of dollars from you, maybe $2,000 out of the remaining $475,000, and then the rest is just quote unquote written off, right? That just doesn't, it doesn't make sense.
Nobody understands it. Nobody understands it, which, that's a problem in and of itself. And so we didn't see the harm, and actually we thought it was a good thing to have our commissioner of insurance and his staff to be able to kind of take a overhead look and kind of look into that deal and and see what we could do different and what we could do better, and how our people in Mississippi are affected by it. Now, you also speak to the prior authorizations bill, which was a separate bill dealing specifically with providers as they deal with insurance companies and getting procedures authorized on the front end before the colonoscopy, before the test, before the MRI. It was a way to speed up that, and in some cases kind of set it to the side. If you've had providers that have been good actors, have never been a problem when it comes to prior authorizations, or the insurance company has said, hey, you're ordering too many of these tests. We think you don't need all these tests, and kind of dinged the provider. These were for providers who didn't have those things on their record, who have been good actors and not been a problem, to kind of speed up the process for them. And so, again, it's about getting paid. It's about those providers getting paid and not doing tests on you as a patient and then finding out, well, the insurance company wants to meet and talk about 3 of those things you did to old Greg because they don't think you needed them. And the doc's like, well, wait, I've been practicing for 20 years. I had never had this problem. Why are we here now? So anyway, it'll be interesting to see. Those are Senate bills. So the way procedure works in the legislature, when a governor vetoes any legislation, the veto message is sent to both chambers, but the bill itself, in theory, comes back to the chamber where it originated. In this case, these were Senate bills. The House we had companion bills that matched them. We just ended up taking a Senate bill. So the House is very much on board with them as we, of course, passed them. So the Senate will have to start an override vote, which would require a 2/3 vote. And then if they could get the votes necessary to override, it would come to the House, where we would, of course, take the vote up as well.
Well, now, I'm a journalism guy. I was never very good at math. But if a Senate bill passed unanimously and it comes back to them with a veto needing a 2/3, I would think that you could probably get a unanimous vote once again to override that veto. But that's ultimately going to be up to the lieutenant governor if he wants to do an override, right?
That other animal creeps into the room called politics, Greg. And so folks start, deciding is what their governor wants worth more or less than legislation that they just voted on a couple of weeks ago.
Unanimously,
So we'll see. So it'll be interesting to see it play out.